February is American Heart Month, a time when people can focus on their health. And Intermountain Healthcare Heart Services, the sponsors of this segment, is working to educate people about ways to enhance their health. And joining me to tell us more is Dr. Pamela Ivy, cardiologist with Intermountain Healthcare. Thank you so much for joining us today.
Oh, you're welcome, Mercedes.
Let's talk about heart health and heart disease. How prevalent is it in the United States?
It's still the #1 reason why people die in this country. You know, every minute somebody dies of a heart attack. It's a message that I think still the public should really hear.
Why do you think the rates are so high?
Well, I think that even now in this time of COVID, we're still seeing risk factors for heart disease that are not being treated. You know, smoking is still very prevalent, even in our teenage population. We're seeing people, unfortunately, be less physically active, and nutrition still is a problem for many people.
They say that an ounce of prevention is worth a pound of cure, and there are ways that you can really help minimize the effects of heart disease. What are some of the things that people can do today to help their future?
So one of the things that every person should do is know what their cholesterol is. That's a really good start. Also know where your blood pressure is. And that usually means a visit to the doctor once a year to get those things measured and taken care of, particularly if you have a family history of coronary disease. That's something you definitely want to pay attention to.
I'm sure exercise is one of the things. How much exercise should the average person be getting a day?
That's a really good question. The American Heart Association says that we all should be getting about 150 minutes of exercise weekly.
Okay.
So that turns out to about 30 minutes, 5 days a week. And walking counts. Walking is exercise.
We love walking. That I mean, it's good for your bones too. It's good for everything. You mentioned smoking. That obviously is something that you can cut out. But let's talk about the everyday stresses. What are ways that we can de-stress?
So I think being with friends, not being alone, going out and exercising, as we've already talked about, taking time for yourself. We're all in this very busy world and working hard, but still having some scheduling time to relax and be with family is always a good idea.
Well, thank you for what you do. Healthcare providers, so you are our angels, and thank you for the great information. Thank you again to Intermountain Healthcare for sponsoring this segment. For more information, visit intermountainhealthcare.org/Nevada. And we